Moving on, this brings us to our next panel discussion on building strategies and reforming the dearth in quality and quantity of healthcare delivery. Dear audience, I'd like to introduce our eminent panel members, starting with our respected moderator, Dr. Poonam Gupta, Head of Quality Improvement, Hamad Medical Corporation and Licensing Inspector, Ministry of Public Health, Qatar, Dr. Mohamed Hamad, Head of Program Quality and Monitoring Unit, International Federation of Red Cross and Red Crescent, MENA, Dr. Alexander Varghese, Hospital Director, New Mowasat Hospital, Kuwait, and Ms. Areej Saqr, Patient Experience Manager, Health Assurance Hospital. Over to you, Dr. Gupta, to moderate this wonderful panel and start this discussion.
Yeah, thank you. Thank you, Roger. So, good morning, everyone. A very warm welcome to Kuwait Telehealth Technology Summit today. Thank you so much for the introduction, Roger. And today I'll be serving as your moderator. And we have a panel of eminent speakers today. And we are going to discuss about building strategies and reforming the dearth in quality and quantity in the context of healthcare. So, just to give a brief introduction, this is a very timely topic and it has received new prominence in the current context. There are 6 quality aims from the Institute of Medicine, which is very prominent and influential framework for healthcare. And it says that healthcare should be safe, effective, patient centric, timely, efficient, and equitable. So, these are the 6 quality aims which makes the healthcare more patient centric, or I should say the effective part, and this is what proposed by the Institute of Medicine. So in spite of having a lot of ample of evidence available and evidence based practices are there, but still we know that the opportunities exist for improvement. There are gaps in the practices and there is a need to do a lot of work in this domain. So, just thinking in the same direction, or we would like to listen from our experienced panelists, like what is their opinion and their experience for this topic, how we can build a system which is more safe and efficient and effective, patient centric and equitable. So, I would like to start with Dr. Alexander. So, good morning, Dr. Alexander, and very warm
Good morning,
welcome.
Dr. Pleasure to
Yeah,
be panel. Hi, Areej and Dr. Mohammed. Pleasure.
Yeah, so we are very pleased to have you on board today. So, just a brief introduction. Dr. Alexander, he is an American board certified healthcare management professional, and he is having more than 19 years of experience in managing hospital operations, project planning, commissioning, hospital quality system management, and consulting. So, Dr. Alexander, my question to you, as I said, that we need to know that there is a lot of work which needs to be done in order to achieve the best quality care what we are giving to our patients. So, what do you think? What are the key roadblocks to improving the quality and quantity of healthcare across the region, maybe country, and how we can overcome that?
Sure. I mean, just to address this point in perspective, thank you so much, Dr. Poonam, for the question. When we talk of quantity and quality from the perspective of a region or a country, several things come into mind. Picking on one of the things that you just mentioned from the Institute of Medicine, the study on doing no harm, to do no harm, was published probably in 1947-48 by the Institute of Medicine. I mean, that's when, quality kind of kick-started. Not that quality did not exist before that, but it was not as measured or not as comprehensive as it started being from then on. So these 70 years of transition and journey has created a lot, in the sense of you've got standards for almost everything if one wants to follow. Awareness is a lot better, a lot bigger, a lot mightier than it was ever before. Regulation across all countries. I mean, Joint Commission is probably the first one to have started. Parallelly, the Canadian body in Canada also did have their accreditations. And we can see over the last 20, 25 years, several countries have come up with their own regulations in line with improving quality and making it safer and better and cleaner, etc., for patients. So this awareness, this involvement by regulation, this know-how of patients as well. Patients are also a lot more demanding these days. So when you look at all of these aspects, they're reasonably well informed. So quality kind of gets driven by these external factors. And a lot has been done and a lot to be still done. When we talk of quantity, uh, it brings us to the key point of this conference. Can technology bridge the gap? Can we en masse treat people? Can everybody who wants access to healthcare get access to healthcare when they need it and make it accessible and affordable? That is a huge challenge. And when you look at a region or when you look at a country, several steps have been made. Long way to go, but several steps have been made in order to. Insurance has always played a large role. Governments insisting that, sometimes the government provides for citizens, but otherwise insurance has been there for several, probably a century or more. So they played a key role in ensuring that there is accessibility to healthcare. If we intersperse that with technology, telehealth, or the capability to do telehealth has been there for over 30, 35 years in the sense, but has it been effectively and efficiently used? I don't think so. Is the region working towards it? Probably yes, in bits and pieces and in silos. Just to give an example, if the GCC came together and said that we will open up this region for telehealth and advanced healthcare through the intervention of technology or through digitalization, can you imagine the impact it can have? For smaller countries like Kuwait, it's not too much. But when you look at this region and you look at the millions who are living here, can they get access? Can I see a doctor that I like in Qatar? Is it possible? Is it doable? Technology allows for it. But what hits the roadblock is regulation. Now, if all of the regulation within these countries speak about quality, speak about patient confidentiality, speak about safety, speak about affordability, then if regulation opens this up, the quantity will be enormous. Everybody in any remote part of Kuwait or GCC or the region at large will be able to access healthcare and access it probably at their budget. In certain countries, the consultations are cheaper. In Kuwait, it is expensive to get a consultation from a clinician. So that said, can somebody here access a doctor which is approved by insurance and which is approved by the region and be able to access that care? It is possible through technology, but the roadblock is probably for institutions and for regulators to kind of work around. So this is in summary to just touch on quantity, how quantity can be enhanced and how quality can be improved, maintained and improved upon. I hope I've kind of touched upon what you want.
Yeah, that was really helpful. So it was nice to know your views on this, and definitely I'll get back to you later on the same point.
Sure.
So let me introduce to our second panelist today. So we have Dr. Mohamed Hamad with us, and he's having 30 years of experience in several health domains, which includes the healthcare program management, healthcare system strengthening, enhancing governmental and private sector service delivery models. So Dr. Mohamed, very warm welcome, and thank you so much for being a panelist with us today.
Thank you. Thank you so much for having me.
Yeah, thank you, Dr. Mohamed. So my question to you, as Dr. Alexander, he nicely explained that what kind of roadblocks we are facing as of now. We have achieved a lot, but there are still the opportunities for improvement. It does exist. And I'm sure that everyone is agreeing with Dr. Alexander's point, what he has mentioned that. And there are some the key steps organization they need to take in terms of quantity when we are talking about. So quality and quantity. So, Dr. Mohamed, from your experience, we know that you have a vast experience in this field, in healthcare fields. So, what do you think? What are some of the tools that organizations they can use to ensure the quality-focused services? So, can you just tell us about some of the tools which organization can use?
Thank you, Poonam, for your question. It's a pleasure to meet you all, Poonam, Areej, and Alexander. The pleasure is mine to be in this very honored and esteemed panel. So yes, of course, quality. I'll get us. I'll go back a step. So what is quality? We have to identify what is quality. There is like a trillion definition what quality means. Is quality patient safety, patient centric? Is it patient satisfaction and not just the patient, the customer satisfaction? Is it quality is the outcome achieved over the cost that we're putting in? So to reach this title of quality. So quality is a very it's a very massive term that we use usually to describe in the healthcare industry regarding patient care, patient safety, achieving the outcomes, patient satisfaction, and sticking to the guidance. So there is a lot of tools to achieve quality in the service delivery, healthcare service delivery. One of which, and I'm here today to talk about it, is being a high reliability organization. So what is a high reliability organization? Basically, it's an organization that takes 5 major strategies to achieve this. So high reliability organization is like your nuclear power plants, like the airplane industry and the flights industry. It's very something that you can really depend on. Very focused on their customer, but also very reliable. The people rely on its processes, standards to achieve the desired outcomes without do no harm, like Dr. Alexander just mentioned. So the first thing that I would talk about to achieve this is the one of which is the preoccupation of failure. So those organizations which want to achieve quality have to really focus on their failures, not to sulk and be sad for the employees that they failed, but to learn from them. It's how you centered your whole work environment around learning from failure. And this is extremely important because learning doesn't come except if you have good access to data and data analysis. A lot of analysis, a lot of data are coming in, relevant data. And then you look into that thoroughly, and then you come up with lessons learned and to not to fail again the same kind of failure. We know that this is also all what I'm saying here is very it's easier said than done. So this is I'm saying it in plain, very simple words, but it's to achieve that in an organization is really, really hard. The second thing that you want to do in a high reliability organization is the reluctance to simplify. So whenever failure happens, it's not the fault of Dr. Alexander or Areej or Dr. Poonam. It's the systematic failure. So we have to, again, get back to the analysis. It's not a person's fault. It's not as simple as you think it is. It has a lot of layers of errors that align together to achieve, or not to achieve, not to achieve the not so demanded or so expected outcome. So we have to look into this. No reluctance to simplify. You have to do the analysis. Sensitivity to operations, that's very important, especially for leadership in those healthcare services. The leadership has to go to the operations. These are the people that on the ground during your Gimba walks, you ask what's the problem, how the challenges are addressed, how to do it better. And you ask the people who are the frontliners. You have to take that information fresh from them and analyze and build on that. The fourth is those organizations are very resilient. They're focused on resilience. Dr. Alexander mentioned COVID-19 and how the healthcare industry worldwide have suffered its employees, healthcare providers have suffered, the organizations and institutions, even big ones, even in very, very developed countries, have really, really suffered. So, but they came through, most of the organizations and the people were resilient enough to come through. So when you say someone is resilient, that he overcomes challenges, he's strong, he's agile, he's trying to get ahead during challenging times. Same with organizations. So those organizations are resilient enough to face challenges, address them, get over them, and carry on. Last but not least, you defer to your expertise. And I'm going to be very transparent and frank here. So in each organizations, and I have a I have a strategy in dealing with friendship within the work environment, because it's a double-edged sword. So you don't get back to your friends, to the people that you trust the most. You get back to your experts. You ask your experts, who's an expert on this topic or this theme? Who did that before? Who failed in that before? And then you ask her or him to give you information. Now, I know, again, that's easier said than done. It's really, really easy for us to go to the person I like the most in the organization. I connect with her or him the most in the organization. I have known her or him from before, and it's easier for us to get to that person. But we have to defer to our expertise in that specific topic or that specific theme. So being a high reliability organization is doing those five things. Yet again, I know, and I'm repeating myself, but it's really easier said than done. It's easy to start, but it's not easy to maintain. It's easy to start at a leadership level, but it's not doing those five things at a leadership level. It's building your organization around those five strategies. That's what high reliability organization means, and that's one of the tools that fulfills your quality.
Yeah.
Over
Yeah,
to
thank
you.
you so much. Yeah, Dr. Mohammad. It was really helpful and some practical tips. So that's really, I do agree with creating a high reliability system where we can focus on the processes rather than the people. And this is one of the key learning from quality whenever we are talking about, like, it's not about a person, it's about the process where we should focus on. So thank you so much, Dr. Mohammad, for your views on this, and I'll get back to you later on for some more questions. So meanwhile, I'll welcome Miss Areej. She is our third panelist. Welcome, Miss Areej. Areej, this a very good morning to you. And again, we are very pleased to have you on board for this panel. Miss Areej, she is having 18 years of international experience in varied roles across the healthcare industry. She is patient experience manager, and she led the foundation of person-centered care, which is first of its kind in any healthcare facility in Kuwait. So we are really pleased to have you. So I know that you have a vast experience in patient experiences and to know the patient voice about the system. So my question will be around patient experience for you. So as Dr. Alexander rightly said that telemedicine is something where we can think about increasing the quantity, and COVID has really, it has shown us like how telemedicine can be helpful in terms
Right.
of quantity, in terms of the cost, patient satisfaction. So what in your experience, Ms. Areej, what do you think? So what is the impact of telemedicine on patient experience?
Thank you, Dr. Gupta, for having me. The first thing, actually, I would like to start with is the concept of patient experience. What is patient experience? When we talk about patient experience, it basically touches on every touch point the patient goes through. So from home all the way to him coming into your facilities, aftercare, continuity of care, and then what is the outcome of that care that we provided for them. Not only that, we also look at the effect that it has on the clinical side, on the administrative side. So when we look at patient experience, we look at the integrated care that we provide to the patient, from the staff all the way to the patient. Now, as an organization and as a department, we have 8 pillars that that puts our patient experience into that framework. One of which is actually technology. And COVID had taught us as an organization that healthcare can leverage technology a lot better than we have done previously before COVID. Telemedicine is a prime example of that. In fact, when you go back to research and you ask patients if they had the choice to have their visit through telemedicine, or they would rather to have the face-to-face interaction, almost 60% would actually rather have it through telemedicine. And the major reasons for that was it's easier for them, it's accessible. They felt like the visit was more tailored to them. And most importantly, they felt like they didn't have to mingle with other sick patients in the waiting area. So one of the things actually we tested as an organization is we wanted to see the impact of telemedicine in Kuwait. So what we've done is this: we developed a program where we can do online. It's like a mini telemedicine. It's not the true full spectrum of telemedicine. So what we've done is actually we developed a virtual consultation as a social responsibility effort from our organization to the community, since we know that a lot of people had lost their jobs. And surprisingly, we had a good number of patients from different population backgrounds with different social determinants, which was a good lesson for us when we think about, sometimes we may assume just because the patients have a low health literacy, that they might not be able to leverage technology or they might not access it. But this is a very good lesson for us to know that maybe we need to be a little bit more adventurous. Maybe we need to go out and reach out to the communities and teach them. Now, how is that impacting patient experience? At the end of the day, if I provide a better access to the patient, if I'm able to cater to his need through the consultations, if I'm able to, provide him with the information that he needs through telemedicine, then definitely that's going to have a better impact on his experience, which in return will impact his well-being, which again, as an organization, will give me a better return of investment.
Yeah, that's absolutely true. I do resonate with you. Yes, even if I'll talk about my personal experience, definitely telemedicine is something I would definitely prefer if, especially COVID has taught us a lot using technology at this time. So thank you so much for sharing your views with us. So now I would like to come again to you, Dr. Alexander. My second question to you, I know that you have vast experience in different leadership positions in healthcare industry and all. So can you just tell us something like if across an organization, what could be the best strategies to improve the quality and quantity?
Right. Quality and quantity both can't say go hand in hand, in the sense when you've got a smaller number of patient population to take care of, a smaller number of patients to handle, you can kind of provide seemingly semblance of acceptable quality. But you are tested when the numbers increase. You are brought to your stretch and your limit points when the numbers increase. It touches upon what Dr. Hamad touched on: high reliability organization. Are we working towards making this safe and secure irrespective of the load? And if it is about increasing or increasing the numbers or maintaining the quality and improving the quality, I mean, you can't kind of just maintain quality. You'll have to consistently work on improving them. From an organization's perspective, I think, as said by most accreditations, and has been known by experience, leadership plays a huge role. Culture of the organization, which is probably driven by the leadership and by the people who've been there in the organization for X number of years, they create the culture. Yeah, it's not just driven by the leadership. So when you do management by walking around, you see that you speak all of those glorious strategies at the boardroom. And then when you go down to the floors and actually interact with staff and patients and visitors and relatives, you see the wide gap between aspirational goals and between what happens on the ground. So to a large extent, leadership, culture, commitment to providing healthcare at this acceptable quality level. So, which is where accreditations play a big role. Sometimes regulations play a very big role. The country specifies what you need to do and what you can't do. So that is some guidance. Accreditation bodies over the last 25, 30 years have played an immense role in kind of bridging the gap and educating people. All of us as administrators have been through the cycle, and we see 20 years ago when we started, the knowledge, understanding, impact of quality was different from what it is today. Has it improved? Surely it has improved. Is there objective data to show that there has been improvement? Of course, there is objective data, but there is objective data to the contrary as well, which shows the innumerable accidents that happen, the innumerable patient bad experiences or kind of harm that happens. So both ways, it's a tool to kind of bridge upon, work towards, and improve. That touches on quality. In terms of increasing quantity of footfalls to the hospital or to the center or the place of work, one has to, I would say, micromanage. You really have to dig down, go in deep, and see if you as a center are seeing 100 patients a day, how can you build it? Do you have the capacity to see 120? And if you have, then how are you going to do this and ensure that the quality remains? So, I mean, some of the things that we've done at Mowasat, I'm happy to just touch upon some of these aspects. Like if a patient is advised for a procedure, the clinician is busy, the patient is advised for a procedure, and what happens next? The patient has the information, and then he goes around asking his friends, colleagues, mentors here, there, maybe with his insurance company, and then he has to come back and actually kind of make a decision whether to do or not to do. It takes a lot of time to actually follow up such patients, basically hand holding them towards this journey, because in a common man's life, you don't get admitted beyond 3 or 4 times unless you're sick and you really have comorbid conditions. After the age of 70, more admissions are acceptable, but in a general life of, other than for pregnancy and delivery, from the time you're born till the time you're 60, 70, 2 or 3 admissions is all one generally has, unless you've got some chronic diseases. So people are not familiar, and you've got to handhold them through this journey. And you have to track them, counsel them, get them the insurance approval. So one needs to micromanage every unit's activity in order to improve the quantity that we're looking at. Footfalls are not going to just increase over a period of time just by doing the same thing over and over again. Like they say, you can't expect different results when you do the same thing. So you'll have to innovate and relook at every aspect. Now imagine somebody's advised for cataract, or somebody's advised for ingrowing toenail, hemorrhoidectomy, dental extractions. So if you look at the number of procedures and the number of surgeons in your hospital and the number of procedures that they are doing, you really can micromanage this and build your numbers from there. But that needs resource, that needs time, it adds a lot of cost, but it would bring about the results and improvement in quantity, which ultimately keeps quality floating. If the institution does not do financially well, quality will be forced to take a back seat. Ultimately, you need to have the numbers to be able to run the business, and you need to be able to be financially viable to move ahead. So as much as one works around improving quality and ensuring that there is no harm or minimal harm or no side effects, etc., to patients, one has to be cautious and work towards improving quantity. And telehealth or technology really bridges the gap in huge ways than one can explain over the session. Telehealth, teleconsultations, second opinions, re-reporting of reports in radiology lab, getting your consultations done when the physician is abroad. Like we've got physicians at the hospital from different parts of the world. When they are on holiday, the patients can't access them. We don't make revenue, the doctor doesn't make revenue. And at the same time, this patient is not served. He's got a physician that he's used to going, and the physician is off for 45 days, and you can't access this doctor. And the patients sometimes are forced to change, which hinders the quantity that we're talking about. Imagine this consultant licensed in Kuwait is on a holiday in US and is able to see 2 patients a day. I mean, something that we agree on as an organization. So the technology is available. Does the regulation allow you to do it? Can he prescribe? Is that acceptable? Is that legally okay? Such are the things. And I think if as a broader concept, quality and quantity go hand in hand, and quantity needs to be there in order to sustain the quality that we talk about. That's in brief, and I hope I've touched on the topics that.
Yeah, definitely, Dr. Alexander. Yeah, it was insightful, and I completely agree when you say that if in order to achieve the quality and quantity, both goes hand in hand, and we need to make high reliability care system, and the culture, it does come from the people who work on day to day basis. So definitely leadership support is required, but then at the same time the people who work in the system, they make the culture. So my second question to Dr. Mohammed, it's in the same line, because we know that we need to change the culture. It's not something which is one size fits all strategy, or maybe we just, it's a, that the culture can be changed overnight. It is not something like that. So Dr. Mohammed, from your experience, what do you suggest that how we can build an organization culture to adopt a customer focused approach, or integrate the quality healthcare services?
Yeah, thank you, Poonam, for the question. I'll get to that. First, I would like to highlight how to maintain and strengthen the culture during crises, because there is a lot of literature on COVID-19 and how that affected the healthcare industry in general and the culture of the healthcare industry. So one of the ways is to manage in crisis, to manage the culture, enhance or maintain at least the culture, is through maintaining the core values of the organization, being empathetic to employees and patients. Sometimes it's very hard because we're all suffering in crisis, especially if it's a health-related crisis like COVID-19. But sometimes it's not health-related. It's a natural event, or it's a conflict in a war, or it's an epidemic, not a pandemic. So sometimes it's really hard when we are also as the institution are suffering from this crisis. It's essential for the leadership and for the organization to keep a very transparent communication. And when I say communication, it's not about us telling the employees or the employees telling the patients. It's about the whole process of communication. What are the tools are we using in communication? What are we telling our patients? What are we in management are telling our employees and staff? What are the medical providers telling their support services teams? So it's really hard, especially in the times of crisis. It's okay to ask for help. It's fine for leadership and for the institution to say, look, this is what we know till now, and we will have to take an action. So ask for help and take an action, an informed decision. Sometimes in COVID, you know that what happened. Very huge organizations, health-focused institutions and organizations, global ones like the WHO and the American CDC, had conflicting messages during COVID-19. So you, as an institution, have to come out and say, this is what we have, this is what we know, this is what the literature say, and we have to take an action. I always say, do not be paralyzed by analysis. You know the code paralysis by analysis. You overanalyze. You're caught in the phase of analysis. You don't do anything. You need to take an action in crisis. Being early in that action is extremely important. So back to your question, Poonam, regarding how to enhance the culture to be quality focused. I think Dr. Alexander said it perfectly. I was gonna say leadership, but after listening to Dr. Alexander, I have to say leadership's not just leadership, not the CEO, not your top management, not your board. It's everyone. A nurse, a regular nurse in the ward that has been experienced in that specific hospital for 20 years, that's also a leadership to her staff. It's a leadership to the new staff. So really focus the leadership on having a very tight communication lines between leadership, and by leadership I mean all the leadership, the formal and informal leadership within an organization. Uh, Focus the message of communication is focused around quality, patient safety, how to reach patient satisfaction. What do we need to do to get there? So leadership, communication, give it some time. Organization do not change culture like Dr. Alexander said overnight, or I think it was you, Poonam. It doesn't. Culture, it's a build-up situation. Now, rest assured, like anything that you want to, get rid of, you can get rid of a culture in 1 week. You can really tear down your culture in 1 week. But to build the culture, that will requires months, years, and maybe decades if you're consistent and you're building towards something. So time factor, put that into consideration. Literature has also identified diversity to be one of, if your organization is diverse enough, it enriches your organizational culture. Each one of us has a lot of, history, human history. So when you bring diverse people, diverse by all means, diverse in ethnicity, in religious, in nationality, any diverse men, women, a lot of diversity will bring that culture to enhancing mode a little bit more. So it will be acceptance. The culture will be acceptance. It will be diversity. It will be respecting the other. It's those things that it's a good foundation of moving ahead into strengthening your organizational culture and be centered mainly around quality. So leadership, and we know that's not top management, formal and informal leadership, communication, time factor, give it some time, and last but not least, diversity. Over to you,
Yeah.
Poonam.
Thank you so much, Dr. Mohammed. It was really excellent suggestion. So I completely agree. Leadership, formal or informal, it is everyone who are working in the organization. They all are leaders in their own way. Anyone who can influence people to take the right decision, right action, and all, and definitely they are leaders. So yes, that is one of the most important thing if we talk about the culture change. So thank you, Dr. Mohammed, for sharing your insightful views, and thank you, Dr. Alexander, for highlighting the culture point in the panel discussion. So coming back to you, Ms. Areej, and again, my question will be somewhere around patient experience. So we are talking about use of technology, right? In this session, there is emphasis on how the technology can enhance the quality and quantity and all this thing, especially COVID time. And we know that there is no way that we want to go to pre-COVID times. Definitely, we will evolve. We want to evolve a new system which is more effective and efficient. So, in the same line, what do you think? What is the impact of electronic medical record system on patient experience?
So, EMRs have been around for some time, but for some reason, it's very difficult to implement in healthcare organizations. And I think big part of it is because when we implement it, we look at it from a system-wide rather than a staff and a patient perspective. So when we decided to implement an EMR system in my organization, we had to look into 6 different things to make sure that it's a positive experience for both the patient and the staff. So when we looked at the patient perspective, we looked what is the most crucial thing that a patient looks for when they come into the clinic, because it's the change from them. Instead of me looking at you and documenting, now I'm looking at a computer and I'm documenting while I'm doing that consultation. So the top thing that they looked at was the patient felt that they having the eye contact with the physician was an essential component of their visit. And so we dug a little bit deeper and we looked into how can we actually deliver that while the physician is able to do that documentation. So we looked actually at the design of the room. If we were able to design the room to where the physician can communicate with the patient as they're doing the clinical documentation, so for example, putting the chair right next to the desk so the patient is able to communicate with the patient, with the physician, and the physician is documenting and talking to the patient, that would have a huge impact on the patient experience. So what we've done as an organization is the design of all of our clinical rooms, whether it's a clinic, a nurse, anywhere where a clinical documentation happens, we ensure that the design is done in such a way that the patient is able to face the caregiver at the time of the care point. The second thing that we looked into is the efficiency. So how do we make sure that the same patient is not getting the lab request twice, or he needs to be sent to have his radiology done twice? And one of the biggest things that we looked at is the streamline of the information. So as an organization, we're going to be catering from primary to secondary care. So we ensured that when the patient will go from primary to our hospitals in secondary, that we're utilizing the same EMR, and this way the information is traveling with the patient electronically. The third thing that we look at is effectiveness. So as an organization, we will be serving almost 1.8 million patients. Those 1.8 million will have different backgrounds. They'll come from different social determinants. And to empower the staff that will be serving those patients, having guidelines available for the physician at the point of care will definitely impact the patient experience. The fourth thing that we looked at was patient-centeredness. So providing patient-centered healthcare is essential in assuring that the patient is comfortable and will comply with their medical care. Because again, the whole purpose of me doing this is to actually empower the patient and give him information and streamline the information with him from primary to secondary and tertiary. So we looked into having a patient portal. This patient portal will have all the information the patient needs to manage their condition. They'll be able to get material in terms of educational materials in different languages. Again, empowering the patient with information to manage their well-being. The fifth thing that we looked at is actually equity. Again, when we're serving 1.8 million people, different backgrounds, different social determinants will play a role. So it's very important for us to have the patient access information from free websites portal, or give them handouts, or whatever whatever might be the case. But we went and took the extra mile to ensure that we deliver that information in different languages. The other thing that we've done from a patient perspective is we developed a family and patient advisory council, where we recruit representatives from each community to come and speak on the behalf of their community. Because as a healthcare entity, we may think that this is the best way to treat the patient, but based on the living conditions, based on where the patient comes from, that might not be ideal. So it's very important that we understand the patient condition, the patient social determinants, and also in order for me to help him, for his well-being. And the last thing that we looked at was the timeliness. So it's one of the biggest issues from healthcare organization is how hard is it for you to get an appointment, long waiting time, and then going back into telemedicine. Having such technologies will definitely connect the physician with the patient and will allow patients to see the physicians at a better rate. They're going to be able to get information about the healthcare, and also help us in things like, especially for those who are disabled, the elderly. So again, accessibility in a short period of time will definitely have an impact on patient experience. So we can, overall, we had seen a positive impact from an organization perspective when we looked at these 6 things.
Yeah, thank you, Areej, sharing your experience with us. And I think you are looking into all the domains of quality when you are talking about the effect of EMR on patient satisfaction. So that was pretty insightful, and I'm sure we will try to, our audience will try to engage or try to adopt many things from your suggestions. So that was really helpful. So as we are approaching towards end of the session, but before closing this and before opening the floor for the questions, my last question to Dr. Alexander. So we know that, Dr. Alexander, the healthcare is a very dynamic field. It keeps changing and all, and we have came through a long way. We have achieved a lot, and still there are things which are to be achieved, or there are opportunity for improvement. But what do you think? What will not change in healthcare for next 10 to 20 years? Is there something which will not change?
Right. I've heard this first with one of the conversations or interviews with Jeff Bezos, and he built around his business, or he shares that he built around his business, thinking about things that are not going to change, because he says everything else will change. So you got to look at what is not going to change and build your business. At least he built his business around it, in the sense he looked at things that is not going to change and built it around. And you know what the results are. We all know what the results are. I believe if you look at what is not going to change predominantly in healthcare or per se would be human behavior. Our behavior to indulge, our behavior to behave the way we want, eat what we want, do what we want, freedom being pushed at its limits. This is kind of natural, inborn, not going to change. So therefore, uh, people coming up with lifestyle diseases or people coming up with difficult situations through their behaviors will continue to be there. So you can expect that as a constant, so to say, something that is not going to change. People are also going to expect higher quality of care and are going to make you accountable. They are, and they will be legally protected, and they will have a voice much more than ever before. So that's, I'm not saying that's not going to change. That's only going to improve for the better or change for the worse, so to say. They're going to really make practitioners, institutions accountable, which is already there, and that's not going to change. They're going to ask for more. Insurance, I believe, which has been there, and I think it's been there, it's time, and it's tested, and it's been there because it helps you to pool in and make it accessible. If there's any other better form of providing greater access to healthcare, we are yet to see one like that. It is provided by insurance or through the public funds that are available with the government, which is again subsidized or some way or the other. So therefore, insurance is not going to change. It's going to be around, and they're going to kind of make it tougher. They will change, but you know where they are going, and you'll have to deal. So that's going to be a constant. If insurance is not penetrated in any market or any area, it's going to be penetrating that area. How we don't take care and attention to the most important things in life. We've all been told that a healthy lifestyle, breathing good air, exercises, good food, walking around, this has been there for ages. Those who listened, and those who didn't listen are paying the price. So we're running healthcare as a business. We see or come across 80% who are paying the price for some sort of indulgence in what they do. And therefore, that's not going to change. People will still continue to do, and you will still need to provide and take care. Last but not the least, I don't know, I mean, most of us work in hospitals, so we constantly keep saying that doctors don't change, they're just the same. They view the administrators very differently, etc. But I believe the doctors, nurses, and administrators are also not going to change too different from what they are. They know they've got the wherewithal of what it is. So this is just a fun point that those things are also going to be static. There are a million things that will change around this, but these I think would more or less be the constants. There are others. I've just shared some that have come on the top of my mind. Thank you.
Yeah, thank you, Dr. Alexander. Thank you giving us your insights about this topic. And I'm sure, what's not going to change, but at the same time, you have given us the solution to bring the change, to do the change culture. If the culture is changed, then definitely we can expect the people who are working, they can improve for the more better way. If everyone is being a leader in their own way, then definitely there is a way. But yes, we need to embed these practices into our model in the organization, and this is how Dr. Mohammed's expertise come into building a high reliability system. And then eventually Ms. Areej, the patient experience. So all these things together, it will build the high quality care system in any organization. So we just like to summarize that high quality services and care, it is the need of the hour, and to make significant strides toward a healthcare system that is more responsive to the patient's preference, needs, and the value, it requires a substantially more attention to apply the strategies that are helpful in achieving this goal. And our eminent speakers, they have given us some practical tips how we can do this and how we can apply some of the tools and suggestions in our practices to achieve this goal. So it was really nice to have you all today. The floor is open for the questions. If anyone would like to have any question, we are more than happy to take it. And thank you so much for being such a wonderful audience. It was a pleasure to have you all on board. And thank you for our panelists. It was a real pleasure to have you all and listening to your expertise on this subject. Thank you so much.
Pleasure. Thank you.
Thank you, Poonam. Thank you for facilitating the discussion. Thank you, Dr. Alexander, Ms. Areej. Thank you.
Thank you.
Over to you, Roger.
I'll be wait for questions. Both Ms. Areej and me are in Kuwait, so if you ever happen to visit Kuwait, please drop by, say hello to us. We don't see too many visitors to Kuwait, nevertheless. And if we do travel to Qatar or elsewhere, we'll say hello to you as well.
Sure.
Yeah, please. Yeah.
But I'll first make it a point to meet Areej or get Areej to meet. We've not met each other professionally other than for this conference, so we'll start with that.
Yes. Thank you.
We're less than half an hour away from each other, so we'll definitely maybe grab a coffee sometime. And Dr. Muhammad, maybe we can have you over.
Definitely.
Yeah, sure. I'm based in Beirut, Lebanon, with the frequent travel all around the region. So whenever I'm in Qatar or in Kuwait, I'll drop you a line.
Yes, please do.
Thank you. Over to you, Bridget or Roger. Is there any questions from audience, or shall we close this session now?
I think someone asked earlier if there's an accreditation body for telemedicine. So the only accreditation that we have in terms of technology and overall is HIMSS, or at least that's what I know in terms of technology.
We do have a question from a person by name Mulidaran Khudar, and his question is on terms of accreditation agencies for quality of diagnostic health in Kuwait and the Middle East. So if any of you could take that question.
She has already replied for this. Areej, she has already replied for this question.
Okay, perfect. All right. In that case, I thank all of you for an extremely insightful panel discussion. Thank you, Dr. Hamid, Dr. Varghese, Ms. Saqr, and Dr. Gupta for this wonderful and insightful discussion on building strategies and reforming the inequality and quantity of healthcare delivery. It was a very great topic and the need of the hour. Thank you once again, and hope you'll continue to have the rest of the day. Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Have a good day.
You too.